So welcome to Chapter 18, and we are going to go over the medicine section. Now, with the medicine section, it is the last section of the CPT codebook, and it's divided into 34 subsections. We are actually going to just do a very high-level review and go over just a few of the subsections, and we can go further into detail during our lab time. And you do get also a lot of information in your textbook, and I just didn't want to duplicate too much from the textbook, so I was not boring you. But the medicine section classifies diagnostic and therapeutic procedures and services, and it's procedure-oriented, so some examples, immunizations, cardiovascular stress tests, chemotherapy. This section also applies to various medical specialties like cardiology, gastroenterology, ophthalmology. It also applies to different types of healthcare providers like physical therapy and occupational therapy. Now keep in mind that there's numerous CPT guidelines within this section, just like we had with our cardiology section, that apply to specific subsections, subheadings, and categories. So again, you'll need to make sure you read these guidelines thoroughly before code assignment. Now the angles of injection, this is just a picture of the different angles of an injection, and this picture is also in your textbook, so it just kind of gives you the different angles for like a subcutaneous, intramuscular, intravenous, intradermal, and the depth that they can go with each of these angles. So dialysis. Now there's a section in the medicine section for dialysis, and dialysis contain codes that are in the medicine section and also some codes in the surgery section. So if there's a procedure for a declot of an implanted dialysis catheter, the coder is going to refer to the surgery section. So if there's just hemodialysis procedure with a single physician evaluation, or requiring repeated evaluations with or without substantial revision of dialysis prescription. This is all going to be in the medicine section. A home visit hemodialysis, prolonged physician attendance. And then here's some procedures that are for dialysis, but you would find them in the surgery section. Again, like I stated, the declotting, collection of blood specimen from a completely implantable venous access device. A lot of it is that device for dialysis or a declotting procedure. And then also there's some CPT codes applicable to a peritoneal treatment. And again, you will see some of these codes you'll find in the medicine section, but you'll also find some of these in the surgery section. So if they had an insertion of an intraperitoneal cannula or a catheter, you would find it in the surgery section under 49420 or 49421. And then here's some treatments for the peritoneal treatment for the medicine section, 90945, 90947, and then for home infusion of a peritoneal dialysis for 99601 and 99602. Now, keys, here's just a few keys to remember for dialysis coding. What type of dialysis is the patient receiving? What is the complexity of the service? How many visits has the physician provided? And here's just a small little graph that shows that the dialysis coding was dialysis coding face-to-face, physician visits per month for patient, and they're less than 2 years of age. These would be the CPT codes. And then depending on if it's 4+ visits per month, if it's 2 to 3 visits per month, that would be 90952. If it's 1 visit per month, 90953. So this is just a little graph of those visits per month. And the next part, you'll go into injection and infusion coding.